Gary Schumann from the VP of Programming at the Temple, bringing you our fourth lecture in our Master Speaker Series. It's an exciting one tonight. I've been looking forward to this one. I don't want to steal Dr. Shapiro's thunder. So, but before we get going, I wanted to let you guys know that if you have a question during Dr. Elkiss's presentation, just put it in the chat to all panelists or everybody, but at least all panelists. And then when there's a good stopping point in the presentation, we'll make sure that Dr. Elkiss knows what it is, and we'll ask. And there'll also be time for questions at the end of the presentation as well. So without further ado, let me introduce one of our members and one of our committee members on the programming committee, Michael Shapiro, who will introduce our speaker.
Thank you, Gary. It gives me great pleasure tonight to introduce all of you to Dr. Mitchell Elkiss. Mitch and I met through the dental realm, and he came to see me, and we got to know each other a little bit, and I was just super fascinated by everything that Mitch had to offer, and I thought he'd be terrific for us tonight. And Mitch grew up here, was born and raised locally here in the Detroit area, went to Oak Park High School and did his undergraduate studies at University of Michigan and medical school at MSU, and became a board certified neurologist with an expertise in osteopathic manipulative medicine, as well as medical acupuncture. So really bringing together a lot of different aspects of the practice of neurology than we're sort of used to in many ways. In 1982, he founded the practice of the Associates in Neurology right here in Farmington, Michigan, in Farmington Hills, Michigan, and practiced there in integrative neurology until last year, right, Mitch, when you retired in 2020, 2 years ago, and integrating the fields of adult neurology, traditional osteopathic medicine, and medical acupuncture with holistic practice emphasizing wellness. Again, a very interesting mixture of things in comparison to traditional neurological practice. Mitch has done a lot of lecturing and is on faculty as adjunct or as an associate professor of neurology at MSU and at the Helms Medical Institute as well, and lectures both nationally and internationally in the fields of integrated neurology and on stress management, and has been frequently teaching programs recently to the armed forces and how to utilize acupuncture for the treatment of stress, and has been providing a lot of information in these times of in COVID-19, which I think that we're going to find tonight a very, very interesting lecture on stress as well. So Mitch, without further ado, thanks for presenting with us tonight, and we'll turn it over to you.
Thank you, Michael. And thank you to Temple Shir Long for inviting me to speak this evening. It's a pleasure. I'm a member of your community, and we all experience stress. We've all been experiencing stress of our own varieties for a long time. Some are common stressors, but I like to talk about how the brain manages extreme levels of stress, not just your garden variety stress, but extreme levels of stress. I'll talk about what that means. And what I hope to achieve today is to enable all of the people that are in attendance, to enable you to recognize the signs and symptoms of the brain's behavior and its misbehavior when it's under extraordinary stress. Number two, to be able to know some tools for coping with extraordinary stress. And number three, to recognize and identify the specific role that Judaism has in helping us deal with extraordinary stress. There's a long history of extraordinary stressors in the history of the Jewish people, as you well know. Why do I need my brain? You know, I sometimes think about this on a regular basis. Well, the brain evolved to direct the body. The simplest organisms didn't really have brains. And as the bodies got more complicated, brains got more complicated to direct their functions. It turns out that the brain creates our thoughts and our feelings and our ability to perceive, all in the service of helping to achieve balance and maintain balance. I'm going to talk about this homeostasis that the body tries to maintain, its balance. And the brain helps in doing that. And also, as social beings, our brains actually regulate one another so that we have an influence upon one another and we depend on one another in self-regulation and in learning how to interact with others. This is like where learning how to play with others starts to come into play. So another thing about the brain is that it evolved to manage the energy needs of the body. So when you're ready to fight or exercise or run or stress, your blood needs to go to your muscles. When you're thinking and contemplating, it needs to go to your brain. When you're digesting, it needs to go to your gut. The brain evolved to manage the energy needs of the body. Also, the brain is primarily engaged in prediction, so that the brain has this idea about, I'm going to reach out there and do something. The brain has a perception of what the world out there is like based upon eyes and ears and smell and chemical senses and tactile sensations. So it says, if I do this amount of thrusting with my arm, it should get me to that hamburger I'm reaching for over there. But it's a predictive mode. And if it doesn't reach it, it's got to make corrections. It turns out that the main corrector is in the cerebellum. So this is something I'm going to come back to later because I can't get this out of my brain. I suppose that's a pun, but it's more than a pun. 83% of your brain neurons, not just mine, but yours too, 83% of them, 102 billion of the 120 billion of your brain neurons are in your cerebellum. That's all I'm saying. I'll come back to it later because I think it means something. So this is this little cerebellum back here, which means little cerebrum. So that's how people thought about it in the old days. And that's 1/10 of the intracranial volume, but it's got 83% of the neurons. What's up with that? So as you listen to me, your brain is busy. It's supervising 600 muscles in your body, balancing dozens of hormones that are pumping through your blood, and the blood's pumping 1 gallon a minute. It's regulating the energy of billions of your brain cells. It's digesting food, it's excreting waste and fighting illness through your immune system. All these are happening without you really thinking about it. So it leads to wonder us, how important is the thinking part of the brain versus the other parts of the brain? I read a book, interestingly enough, called Kindred recently, called Kindred, Neanderthal Life, Love, and Death and Art, and by Rebecca Ragg Sykes. And a couple of things, besides the fact that this guy looks vaguely familiar to some of my family members, she concluded that the Neanderthal existence, which was up until 40, 50,000 years ago, still on this earth, and they were around for a couple 100,000 years. They weren't a trivial flash in the pan. That their existence was founded, just like our existence is founded on emotion, on fear, avoiding it, pain, avoiding it, pleasure, seeking it, excitement, seeking it, desire, following it, our hearts pounding, our guts roiling, our muscles tensing. These are the things, our physical life that was the basic existence then and now. But just as it was then, as it is now, there was a desire for transcendence. That's why there was things like art and ritual, etc. I recently heard a podcast by Yuval Noah Harari. And this is the link. And it was called 2 Million Years in 2 Hours. He's a brilliant speaker. And he talked about Stone Age feelings, Paleolithic values, gut feelings, intuition. This is, this is how I feel about that, right in my gut. Well, that's okay to have those gut feelings and those intuitions and to be in touch with them, but you should know that they are very prone to error and they can be hacked. So, for example, people can be propagandized into believing certain things and reacting in certain ways, and prone to error in the police world and the policing of minority populations. We see a proneness to error that has become unacceptable. So these are gut feelings that are prone to error, and so they need to be honored, but they are prone to error. So they must be understood in that context. But our Paleolithic values are being meted out through medieval institutions. These are our courts and our congresses, etc. And yet we're in the face of transcendent technology, which he actually called godlike. I didn't want to be disrespectful, so I'm calling it transcendent. But this is sort of the current dilemma. How do we rationalize these old ways of reacting with our new ways of understanding? So what's the role of stress? It turns out that back in the 19th century, they identified, it was Walter Cannon who identified the idea that homeostasis, the body, it was a guy named Claude Bernard who says, you know, your internal milieu is remarkably stable over time. You keep the same amount of fluid, the same body temperature, the same body acidity, alkalinity, the same body oxygen level, carbon dioxide level. All those are maintained within fairly tight parameters, temperature, things like that, blood pressure, pulse rates. And there's something that's about the body that keeps it self-regulated. And then there are the stressors that come from outside that try and move you from your homeostatic place. So it's because of allostasis that homeostasis has to exist. So allostasis is the corned beef sandwich that you had that threw your blood sugar off into the stray out zone, and your body has to bring it back into control. So when it comes to stress, as it turns out, just the right amount is good. That the performance graph and the stress levels are an inverted U shape, so that when you're totally unstressed, you know, like unstimulated for that matter, as they say, inactive and bored, then your performance is fairly poor. They call it lame. As you get more motivated and develop a healthy tension, you start to perform better. And at peak performance, you're focused, you have a moderate degree of stress, but that's your peak performance. And after that, more stress or more, is this related to cortisol, as it turns out, related to the release from your adrenal glands. After more stress, you actually start having diminishing outcomes. So then you get fatigue, exhaustion, stress overload, panic, anxiety, anger, burnout, breakdown, disease. It's not good. So there's a right amount of stress and there's a wrong amount of stress. And this is a picture of a Lorentz attractor. This is from chaos theory. Some of you may know that. This is a computer graph of a self-repeating process that always comes back around a central magnetic center. Though it can range far away and back, it always comes back to the center. This is like homeostasis. And you can judge the quality of a system's health by its range. How widely does it range, and its flexibility. So its range is, if it only goes from here to here to here, it's got a narrow range. If it goes from here to here to here to here, it's got a wide range. If your heartbeat can go from 80 to 150 comfortably, that's a fairly wide range. If it goes from 80 to 100 and you can't go beyond that, that's a narrow range. And then there's flexibility. How big of an intrusion can it handle and still self-regulate? In other words, how big of a dump of sodium salt can it handle and still come back to a self-regulating normal sodium range? Or would it be thrown out into the outlying non-regulatory zone where it couldn't bring itself back on its own behavior? This is something that a friend of mine came up with some years ago, and we developed in the context of pain, and it equally applies to stress. And it comes with the basic premise that these three elements, the nervous system, the immune system, and the endocrine system, respond to all stressors, and pain being a stressor responds to stress. And this theory that was proposed beautifully by David Chapman was a wonderful theory that talked about the autonomic nervous system linking the immune system and the nervous system and the nervous system and the endocrine system, and the circulation linking the endocrine system and the immune system and the endocrine system and the nervous system, and the cytokines, which are the immune products. You've heard about the cytokine storms now. The cytokines are being released by the immune system, and they're influencing through the circulation and the fascia, the connective tissue, all these other structures. But it's through the body doesn't have any agency to act without the musculoskeletal system. So we added, actually, I added the musculoskeletal system to the INE system and created the MINE system, so that the nervous system has to work through the musculoskeletal system to get its needs met. The immune system has to work through the musculoskeletal system to activate its defense mechanisms. The endocrine system has to work through the musculoskeletal system to activate all of its full responses. And when we talk about the response in response to stress, the range of resilience is the range between the passive, relaxed, I'm mellow stage and the active, I'm under stress stage. And this is broken up into two parts of the autonomic nervous system, which is called the sympathetic branch, which is active. That's the fight or flight branch, or the parasympathetic branch, which is just the rest or digest branch. So this is what normally happens. Normally there is activation with stressors, stress management, time to rest, go back to the cave, finish up my lunch, rest, go to the bathroom, take care of my excretion. Oh, there's another woolly mammoth at the door. I fire up there. I got to fight off the woolly mammoth, get some dinner. Okay. And then it's resting time. And that is the healthy rhythmic alternation between them. The unhealthy version is when something of so traumatic nature gets the system out of its sine wave function and gets it stuck either in an on position, stuck in an on sympathetic fight or flight, like I can't stop fighting, I can't stop running, or an off position, I can't do anything, I can't respond, I'm paralyzed with inactivity. And so that creates a disrupted flow within the nervous system. That's the freeze response when you're stuck in the off position, and stuck in the on position is the fight flight response. Now it turns out that the fight or flight response is relatively controlled by the sympathetic nervous system. That has to do with the manifestation, the behavioral manifestations, and the physical changes within that go along with the emotional stages of rage and anger, panic and fear, anxiety, worry and concern, separation anxiety, sadness, and these are all negative events. And they trigger the fight or flight as needed. But it turns out as the activation goes up, they get more triggered. If it's an overwhelming event, then it just bypasses the sympathetic altogether and goes to the dorsal vagal nucleus that causes just a complete shutdown. You go limp, you play dead. That's the freeze response. And normally you'd say that that is a protective, a shutdown response. And it's a hopeless state where the animal prepares for death. This is like the gazelle being dined upon by the lion while it's still alive. So when this happens, the brain has a mechanism for releasing massive amounts of endorphins so that there's really no pain while that gazelle is being eaten, according to what the gazelle told me. So the dorsal vagus activates this shutdown, but over the development, a ventral vagal nucleus developed, which allowed for social engagement. Because if all your repertoire was to either fight with whoever was there, run away from them, or fall down and play dead, if a neighboring, Paleolithic person, a Stone Age person came by, or even if your own children came by to nurse, or if you wanted to make connection with your own children, how would they know not to play dead or to get all aroused fight or flight style? So along the way, you can see the dorsal motor nucleus is this magenta structure back here, but over time, the ventral, which they call the nucleus ambiguous, I love those kinds of names, the nucleus ambiguous developed, which allowed it to override the shutdown. So it allowed, and it also controls the motor control to the throat, the larynx, and the pharynx. So it's like the, and so like the beginning grunting communications between people. So when the stress level is low, then social engagement can take place, curiosity, etc. We'll talk about these things. So again, in the middle range, it's a sympathetic nervous system, the fight or flight. As it gets higher and the neuroception of danger goes up, the likelihood of you're either saying, I better run or I better fight gets greater. If it's overwhelming from the get-go, many times, like if you think an overwhelming stressors come along, not uncommonly, the first thing is to just freeze and see if maybe it'll just pass you by. And The example of the possum playing dead, I'll show you in a moment, is a real life example of how that manifests. And then in the situation where there's a safe zone, the ventral vagus overrides the dorsal vagus and allows for social engagement. Now, this dorsal vagus, slows the heart, puts the body almost in a state of hibernation, which is good for when it's facing mortal attack. It's bad though. We see this in the maternal laboring wards. If you see fetal decelerations, that's a sign of the vagus nerve under stress. And so that's the dorsal vagus acting itself out. And it's a sign that there's stress on the fetus. So all these result in either fighting or running or facing the enemy or the threat or the social engagement counteractor and or freezing. Now, this is an interesting theory. This is Paul MacLean's theory of the triune brain that was developed during I think in the 50s. I first read about it in the early 70s. And he thought that based upon ontology, the way animal morphology evolves over time, that we all share with our lower reptilian ancestors a reptilian brain. We all share with our earliest mammal ancestors a paleomammalian brain, which we call the limbic system. And we all share with our primate mammalian relatives a neocortex. So the reptilian brain is the autopilot. It's the emotional behavior, the immediate fight or flight, the survival mode. This is you do without thinking. This you do instinctually, or else you don't survive. Then, as the paleomammalia system developed, it said, well, last time I did this, it didn't work so well. Or last time I did this, I wound up with lots of bruises on my head. And so I think I'm going to reassess and maybe check how is the strategy of mine working? This yelling at everybody to go away. Is that working? Are they going away? Or this stomping around, is it working? Are they going away? So how is my strategy working? And then finally, as we develop the neocortex, well, wait a minute now. Based upon reasoning, what I can imagine is going to happen from previous experience, what these people are saying when I'm extracting from their behavior and what I can think about, I think that I should modify my strategy and do this, that, or the other thing to survive. And that's the goal. Now, the part of the brain that is the reptilian brain is this blue part, the brainstem all the way up to the hypothalamus. The part of the brain that is the brain that is, I said that slightly off. The part of the brain that is reptilian is both the hindbrain and is a portion of this midbrain. So these are both reptilian brain. This part here, as you'll see, is a paleomammalian brain, and the neocortex is the neomammalian brain. But these are all lizard brain. And if you look at the amount of lizard brain in shark, they have a fairly significant amount of brainstem and a little bit of midbrain and not much cerebrum. This is an embryonic vertebrate, a lot of brainstem and not much cerebrum. Oops, I went the wrong way, sorry. In a goose, a lot of brainstem and cerebellum, a fair amount of midbrain, not much cerebrum. But then, of course, in a human, brainstem, cerebellum, and lots of cerebrum, and still a small midbrain. But that's where our emotional center and drive comes from to a large degree. So the reptilian brain is responsible for these structures, the midbrain, and even some would go as high as the hypothalamus. It's instinctual, it's involved in surviving, finding safety and sustenance. It's involved in all the basic functions of maintaining homeostasis, the right temperature, the right nutrition, the right body composition. It's how you respond to stress. Allostasis is the body's response to stress. And it's either triggers a freeze through the vagus nerve, as it turns out, or a fight or a flight through the sympathetic nervous system. And that the goal is to survive and to procreate. these are interesting pictures because on this side, you have the sympathetic nervous system versus the parasympathetic nervous system. Now, the sympathetic nervous system was described by Galen in the 2nd century in Greek descriptions. He talked about a system of, and he had dissected these nerve. So the system of the sympathetic nervous system comes from the hypothalamus, descends, and has a synapse in the spinal cord, and then goes out to the ganglion. It has a synapse in the spinal cord, and then the 3rd order neuron goes to the ganglion, and then over to the organ with which it's connected. So that these chain of ganglia were dissected by Galen. And he knew that they were connected to the internal organs, and he thought that they were responsible for the sympathetic interaction of the organs. That's where the sympathetic nervous system name comes from. So they worked sympathetically with one another. It was only later in the 19th century that the autonomic nervous system developed its parasympathetic branch, when it was discovered by, it was really mostly Walter Cannon, who was the man who figured out that there was another component that came from both the brainstem and the very tip of the spinal cord, the sacral spinal cord, and they controlled the parasympathetic, the rest and digest system. The cranial part mostly is about tears and saliva production in the head, but the vagus nerve, the big one that comes out at the base of the skull, controls all the organs in the chest, in the thoracic cavity, and the abdomen, and most of the ones in the upper pelvis. They don't control the lower pelvis like the ovaries, the uterus, the bladder particularly, because those are taken care of by the sacral parasympathetics. But the vagus takes care of all the other parasympathetics, and that there's a balance between the sympathetics and parasympathetics. And during stressful times, sympathetic turns on, the blood is shunted away from your digestive apparatus to your skeletal muscles to prepare you for battle or running, to your brain to prepare you to think, away from your digestive system, away from your, if you were having intercourse at the time, that's done. And when you're done fighting your stress, then you get to return to your parasympathetic state of finishing your meal, digesting what you were doing, and resting and recuperating and healing. Back in the day, there was more of a chance of fighting your demon and then having a rest period. Nowadays, a lot of people don't get to fight their demons. They have to live with them on an ongoing basis. That creates chronic stress of a special variety. This picture shows the yellow of the sympathetic nervous system. These are the chain ganglia, and all of the plexuses of the yellow nerves in front of the big organs. These are like the chakras, remember, the solar plexus and the mesenteric plexus. And the green are the fibers of the parasympathetic. So these are all vagal fibers, vagus nerve, vagus nerve, vagus nerve, vagus nerve, vagus nerve. And these are the sacral nerves. And you can see the way the parasympathetic and sympathetic embrace the organs. Now, interestingly enough, the sympathetic nerves have long arcs from their chain ganglia all the way to the organs. Parasympathetic nerves, on the other hand, have their last synapse right against the walls of the organs themselves. And so the vagus nerve, you can see, comes from the cranial base, goes down the esophagus into the thorax, chest, and lungs, all the way to the stomach and the small intestine, a lot of the large intestine, except for the descending portion of the rectum and the pelvic portions. And that this is parasympathetic, and it's connected therefore to the enteric nervous system, which is the fact that the wall is where the last synapse of the parasympathetic nervous system is. And it turns out that the most abundant kind of nerves in the nervous system of the autonomic nervous system, there's a sympathetic nervous system, there's a parasympathetic nervous system, then there's what's called the enteric nervous system. And that's where the nerves of the gut that include both the nerves that work the muscles of the gut that cause peristalsis and the nerves that cause secretion of the juices from the gut. They're controlled by these nerve plexuses, and they represent the largest collection of nerves. 100 million nerves are in the enteric nervous system. And we're just even now starting to understand it, because the vagus nerve, when I was taught, it slowed the heart, it made the gut royal. Okay, I knew that. It was also associated with the gut feeling. I really didn't know that till I started to understand more about what gut feeling meant. It definitely had a calming effect because if you were sympathetically overdriven, you couldn't be relaxed, you couldn't be calm. So parasympathetic had to do with calming. When I was taught, the parasympathetic came out the vagus nerve, but that was efferent. The afferent part of it, the ingoing messages, we didn't understand very well. But now it turns out that of the vagal nerve fibers, 90% of them are ingoing fibers coming from the gut going to the brain. And they monitor the feeling of being sick. So when you feel sick, it's the presence of cytokines in your circulation that your vagus nerve is sensing and saying to your brain stem where it's going up there and saying, whoa, you're sick. So it is what gives you that gut feeling, that sick feeling. And as you can imagine, well, I didn't really understand this fully, but it has to do with the relaxed state. It also strengthens the memory and it decreases the inflammatory response, which is curious because now we start to understand that the vagal nerve tone is an important measure of good health, and that sinus arrhythmia, as I'll show you on the next slide, is a measure of vagal nerve health. And sinus arrhythmia is another way that you measure heart rate variability. And any of you that have biometric devices like Oura rings or Fitbits or other kinds of Apple Wear will find that it measures heart rate variability. And I'll show you what that means, because it's a measure of vagal tone. But vagal nerve stimulators then became something of a thing. In neurology, they were first used for, these are things implanted in the chest like a pacemaker that go up to the vagus nerve, and the vagus nerve goes to the brain. The stimulator is here. It's used to turn off a seizure. It's now used to turn off a migraine. It's now used to treat certain kinds of depression. It's now used to treat the inflammation of rheumatoid arthritis. What? This is way different than the inflammatory, than the vagal nerve I learned about. And part of it also has to do with the fact that the vagus nerve is monitoring all the action of the cells inside the gut, the microbiome. So for example, serotonin, which makes us have a feel-good glow in the brain, that 10% of the serotonin is made in the brain, that 90% of your body's serotonin is made in your gut. What do you know? So the vagus nerve, this is sinus arrhythmia. Sinus arrhythmia shows that when you breathe in, the heartbeats are closer together. When you breathe out, the heartbeats are farther apart. This is an indicator of increased vagal tone, farther apart. This is decreased vagal tone, closer together. And the variability with the respiratory cycle is what you're looking for. And when you lose heart rate variability, that's a sign of poor vagal tone. How can you build up your vagal tone? Here's a quick short course on how to build your vagal tone. 4-8 breathing. Breathe in 4 through your nose. 1, 2, 3, 4. Breathe out 8 through your mouth against the resistance of your tongue. 1, 2, 3, 4. 4-8. That's also known as Ujjayi breathing in yoga. It's also known as sniper breathing because you breathe in and you breathe out. And at the maximum vagal tone, when there's the least amount of tremor in your system, you shoot. It's also known as biathlon breathing. It's also known as gorilla walk breathing, because when you hulk over like a gorilla, you go into that breath. It's also the goal of Kundalini yoga, to stimulate the vagal nerve. You also can stimulate by putting your face in cold water. You haven't got time for these other things. But these are all ways of stimulating the vagus nerve to get it back online. The polyvagal theory, which is a notion that comes from the idea that first we had the dorsal vagal nucleus that made us freeze when we had any kind of confrontation of any sort with a friendly or an unfriendly sort. The input from that was coming in went to the solitary nucleus. That was the input nucleus. And the output went from the dorsal motor nucleus and caused the freeze. Freeze, playing dead, possum. Over time, the nucleus ambiguous developed, went to the soft palate, pharynx, and larynx. And that allowed an override so that in social and safe conditions, and this is a work of Stephen Porges that he wrote about in 2011 in the polyvagal theory, that Social engagement can occur, emotions, attachments, communication, and even the ability to learn how to self-regulate. And his idea is that you learn how to respond to stress beginning in the womb, intrauterine, with like the fetal decelerations. You're learning how to respond early on. And the way you learn how to manage your sympathetic, parasympathetic balance sticks with you over time through life. And so it determines your way of reacting, in fact. Now, the paleomammalian brain is this limbic brain. It shows up in the earliest of the mammals and birds. It pays attention to important things in the world around it, the salient brain. It's where feelings start to develop. It's also where the freeze, fight, flight response is assessed for how well is it working. It's the part of the brain that says when it walks into congregation, shir shalom, am I safe? Am I wanted here? Where it says yes, but if they walk into congregation, don't want to go there, that you walk in and it's like, I don't think so. This doesn't feel like my kind of place. That's the limbic brain that's feeling that. Emotional learning takes place in this part of the brain. And also the ability to love and care for others, the young and the old alike. So this part of the brain, this intertemporal lobe, the hippocampus and amygdala, and the uppermost brainstem, the hypothalamus, do a very fast subconscious evaluation and a response activation and a quick assessment and a modification to determine, am I doing the right thing in the face of what I think is an emergency? Now, the neomammalian brain is this hunk of brain. And you may say, and I have said, well, look at how big that is. That's a lot of brain. And that little cerebellum, remember I said it's 83% of the neurons. How could that possibly be? How could that be? And it has to do with the fact that the neurons in the brain are mostly enclosed in this outer quarter inch of the rind of the brain, the cortex. And this white matter of the brain is mostly pathways, connections. So connectivity is a big part of how the brain gets its work done. Now there are deeper gray matter centers, that is true. But the neomammalian brain is what we're talking about now. It's the rational thinking brain responsible for thinking, thoughts, words, deeds, creativity, imagination, and mostly it's predictive. This is what I think is going to happen based upon past experience if I do this. And then post-action assessments. Oh, I did this, it's not working out, or it worked out really well, and now this is how I have to modify, or I don't need to modify. And particularly the brain doesn't spend a lot of time online unless there's a lot of uncertainty around. If things are pretty cool and predictable and you can run on autopilot, the brain finds it very energy efficient, and it only gets online, the neomammalian brain, when it's attending to uncertainty. Now, post-traumatic stress injury is characterized by flashbacks and nightmares, severe anxiety, hypervigilance where you're on edge, uncontrollable thoughts about the event. I can't stop thinking about the way that person couldn't breathe, and I can't stop thinking about that. And emotional numbing about, well, I can't keep feeling this. I have to get numb to it if I'm going to survive. And it can be triggered by experiencing, witnessing, hearing about a terrifying event. So all of us caregivers, all of us family members, all of us clergy people, anybody that watches the news, we all have post-traumatic stress injuries. And it affects our ability to live normally by affecting our role in society, our ability to work in relationships. It's a specific subset. So this work about post-traumatic stress injury comes out of my work in the military. And I'll talk about that in some detail in a moment or so. But additional branch came out in the work with COVID-19, because with the additional stress of being in isolation, having fear of contagion and lack of adequate protection, having a lack of solution for the early days in particular, feeling a sense of betrayal and moral injury. These are all characteristics of post-traumatic stress injury of the military variety and of the COVID-19 variety. And they lead to problems like addiction, alcoholism, suicidality, divorce, domestic violence, emotional numbing, loss of the ability to function. And it turns out that there's risk factors for having this problem, that the medial temporal lobe, this is the brain, this is the temporal lobe, this is the medial temporal lobe. This is the hippocampus normally, this is a shrunken hippocampus. This is what happens to the hippocampus under stress, too much stress. So risk factors for PTS injuries are a history of long-standing trauma or extreme, short, intense trauma, early life trauma that sticks with you. Career, so all the migrant children that were torn from their families, they have PTSI guaranteed. Certain career exposures, first line, front care line workers, you know, EMS, doctors, warriors, certain careers, firefighters, prior mental health issues, prior substance abuse issues. These are all predictors of potential risk for PTSI. Poor social network or a family history of mental health issues, or having already had injury to your hippocampus or a small hippocampus. As it turns out, the hippocampus has been explored a lot for reasons beyond just that. But the post-traumatic stress injury is intrusive memories, avoidance behaviors, negative changes in cognition and mood, and changes in physical and emotional reactions. There's nightmares and flashbacks. So these are intrusive memories in the night or in the day. Avoidance behaviors related to uncontrollable thoughts. So if my problem occurred or a certain song was playing when I found out that my Aunt Tilly died, now I can't hear music by that artist because it relates to bad thoughts that come flooding back. Severe anxiety and depression are the negative changes in cognition and mood, and irritability, hypervigilance, insomnia, and emotional numbing are the physical changes. Now, originally we thought the hypothalamus was a leading problem because hypothalamus regulates homeostasis and hormones and the sympathetic nervous system. And there was a test that we could do called the dexamethasone suppression test. And when you gave a person with a PTSD the dexamethasone suppression test, they did not show proper suppression of their hypothalamus. So the hypothalamus has two properties. One, it's the first cell that turns on the sympathetic nervous system. The second cell is here, the third cell is in the ganglion, and that turns on the organs. And the adrenal gland releases adrenaline. The other part of the hypothalamus works through the hypothalamic pituitary axis and releases ACTH, which stimulates the adrenal cortex to release cortisol. And cortisol normally feeds back, but in PTSI, in spite of the feedback being strong, the hypothalamus remains overactive. So the hypothalamus, in case you want to know where it is, this little teeny triangular territory right above the pituitary gland. In the old days, they used to go through the top of the brain to get to it, and those surgeries were not so good. Now they go through the upper lip or through the nose and go right through the sphenoid bone, get right to the pituitary gland. This is that same territory, but this is that gland, the hypothalamus blown up, and its connection to the pituitary gland. You can see it's made up of multiple smaller clusters of cells because they regulate temperature and they regulate appetite and they regulate blood pressure and they regulate pulse rate. They regulate all these hormones, and that's under the control of the hypothalamus. The posterior, the back side of the pituitary has to do with oxytocin, which has to do with bonding, and vasopressin, which has to do with sodium control. So it's all about homeostasis. Now, the next part was this hippocampus, because they found that people coming back with post-traumatic stress injury from the war had small hippocampus. And then they actually were able to do screening tests in San Antonio for some of the Delta Ranger positions, that if you had a screening MRI that showed a small hippocampus, you were rejected from that training. So this hippocampus is named because it means seahorse, because it looks like a seahorse. This is a dissected hippocampus. And it's a very fascinating part of the brain. It's wrapped around the inner part, the most inner part of the temporal lobe. And the hippocampus is this green wrapped around the inner temporal lobe. And it's this medial temporal lobe. It's where memory consolidation and retrieval takes place. Learning has been first demonstrated there. It takes place other places, but learning was first demonstrated in the hippocampus. This is where navigation through space, a rat will navigate through a maze based upon its navigation activity through the hippocampus. Certain cells fire when it turns right, certain cells fire when it turns left, certain cells fire when it's up against a wall, certain cells fire when it needs to turn. So spatial and also through time, temporal navigation takes place through the hippocampus. So response inhibition, deciding to go one way or the other, is decided through the hippocampus. And all memories get stored, have to get processed and stored through the hippocampus on their way to being stored in the cortex and all the other places. And when they're retrieved, they have to get retrieved through the hippocampus. So the hippocampus is his librarian and the neocortex is the library. It encodes and encrypts events in time and space. That's why people frequently that have had extremely stressful events say that they feel like the event isn't well anchored in time and or space. But then we found out that there's a tip of the hippocampus, anterior medial tip called the amygdala, which is the relevance detector, the earliest warning system the system has. And it's where safety first is the motto. It receives a fast track from the thalamus, and it shows increased activity with post-traumatic stress injury. And it has to do with the processing of memory, but especially the memory of emotional behavior and motivation. It has to do with decision-making and keeping a safe distance. But this is interesting. In 2017, they showed that people with higher resting amygdala activity, which is the case with PTSI, that this predicted heart attacks and strokes, more heart attacks and strokes because of inflamed arteries and excess blood production. So stress correlates with this and it correlates with that. Not good for you. So this little amygdala, which means an almond, this little almond-shaped tip on the tip of the hippocampus is really important. So the fast track is this red line. The purple track is a slow line. So you see the snake, the slow line is the normal response. You think about it, decide what to do, you respond. The fast track says, see it, respond, then think about it. So this is how it manifests. Okay, this one says, okay, I'm gonna think about it. There's a snake, but I'm just gonna think about it. And so I'm slow to speed up my heart rate and I'm slow to speed up my blood pressure. And so I'm slow to run away from that snake. This one says, I see a snake. I'm quick to jump in my heart rate, quick to jump on my blood pressure, quick to run away, but it's also prone to error. It was just a coiled up hose. So the intuitive gut Paleolithic feelings are strong, but they're prone to being hacked. They say that we have three innate fears: snakes, heights, and darkness. And it's regulated through this amygdala. Now the last part is a prefrontal cortex. This regulates empathy, insight, response flexibility, emotional regulation, qualities that we link with mature responses, morality, intuition, attuned communications, and fear modulation. But the problem with extraordinary stress is this is what happens. The frontal cortex is overwhelmed and is offline. Hippocampus is overworked and underperforming. Amygdala is overstressed and causing problems. Hypothalamus is over-secreting and the cerebellum isn't coordinating things. Okay, here's my word about the cerebellum. 10% of the cerebellar volume, 10% of the brain's volume is in the cerebellum and 83% of its neurons. As a neurologist, I was trained that the job of the cerebellum was motor control, coordination, balance, things like that. Turns out that studies out of Washington University in St. Louis just a couple years ago showed that 80% of the functions of the cerebellum are related to non-motor activity, mostly affect, emotion, and thinking, cognition. What? That's crazy. That's like totally changed my view of the world. And so I became a self-described cerebellist in 2019. So normally we think of the cerebellum, we're taught ataxia, clumsy, drunken, walking or speech, dysmetria, past pointing, you can't touch your nose, what they would do for a drunk test, nystagmus, following the eyes and seeing the jerky movements at the end of vision, or the inability to do rapid alternating motions, dysdiadochokinesia. These are the things that classically we were taught as cerebellar pathologies. But now I decided that there's other problems. I think that there are problems called affective ataxia, people that are clumsy with their emotions, that they don't respect boundaries, their interpersonal relations are handled clumsily. People that have cognitive dysmetria, they miss the point. They overshoot. Their stories miss the point. They don't get the point of the message that they're being told. They don't understand the moral of the story. They don't get it. And people that can't make rapid changes in their lives in real time. People that have dysdiadochokinetic syndrome. Now I've made these up, but I think they apply in real world. And so much so that in all of my therapeutic prescriptions, I always include some kind of balance exercising, whether it be yoga or balance boards or whatever, or Tai Chi. I want to include this. Last thing about the brain, and that is, lest you think it's a switchboard and one leg says, Molly, you got pain, better let amygdala know we got to move fast, plug it into amygdala, and that plugs into the hypothalamus and makes it work. Well, actually, that's not how it works. There's networks of the brain. This is the network of the default mode network. When you're at rest, you're just idling, introspective, meditative, and then suddenly there's a noise. Your insula turns, you look, your anterior cingulate cortex turns on, then you decide you have to take action, like the house is on fire. Your motor central executive network turns on, your prefrontal cortex turns on, actions start to take place. So the shifting between these takes place, and it's the anterior cingulate cortex that conducts that symphony. Now, emotional experiences teach us what to avoid, what feels bad, but also what feels good. They're the affective experiences. They're the ancestral voice of the genes. This is what we have learned from our ancestors. These experiences are about survival, but they can also be about creativity. So you can turn these strains within to ways of planning and developing, introspecting, reflecting, making ethical choices and managing your emotions, reasoning and abstracting and problem solving, like Viktor Frankl, finding meaning in life through activity. And this is a couple thoughts I have about patient treatment. One is that when two people get together, if it's doctor and patient or clergy and congregant, there's something that takes place. With doctors and patients, there's a partnership, certainly. And there's a synchronization. Both come in vibrating with their own heartbeats and brain waves and heart-lung apparatus and muscle stimulation activity. And together they join together in some kind of simultaneous synchronization, this one-on-one entanglement that allows them to get the work done. And that can be positive work where you engage the positive work that the patient's own nervous system can produce, the placebo effect, or it can be negative. Like if you say, this is going to be helpful, I think this is really going to work for you, you're going to be good with this, that's placebo engendering the brain's own capacity to do its own good healing, versus saying, this is bad for you, this is going to hurt you, this is going to be really terrible for you. And that's setting the nocebo, the negative expectation up. And ultimately, you also have to care for the caregiver, because the constant between all the doctor-patient relationships and all the different ones is the doctor stays the same, so you have to take care of the caregiver. This was called the doctor-patient relationship, but I'm calling it therapeutic relationships. These are coupled oscillators. Two people working together, they're synchronized. And there are emergent properties of the dyad. The A and the B is an AB, which is more than just the sum. And it works in both directions, whether it's through touch, needles, words, sound, ministry, all these different ways. Now, these are things that are done now in my practice. For example, when the military contacted me as part of the acupuncture treatment group that was working, training the military physicians, they said, we have special needs. This was 12 years ago. We need to have special work done for PTSD. And I was with a group at the time of senior leaders, and they said, well, what points should we use? And I said, well, I don't know much, but I know that the structures involved in the PTSD are the hypothalamus, the amygdala, the hippocampus, and the prefrontal cortex. They became the 4 points of the auricular trauma protocol, to which were added Shenmen and point 0, which is the center of the ear and the spirit gate. And the idea is that here is the homunculus. Most of the upside down person is represented on the ear with their brain down here. So all the brain points are down here. We developed an ear protocol that we've been teaching for the last 12 years in the military with needles to the ear to help regulate and mitigate extraordinary and extreme stress in soldiers, both in acute experiential stress like frontline experiences and chronic stress like in veterans. We then took this and partnered it with another technique called calming and centering, which it combines the 4 gates, the 2 points on the hands, the back of the hands, which are the gates of heaven, and the 2 points on the tops of the feet, the gates of earth. And they're close to the sympathetic nervous system. They sedate the sympathetic nervous system. And these 2 points on the head, at the top of the head and at the brow, which triangulate at the hypothalamus. And these 6 points calm the sympathetic nervous system. And we launched the CRDP protocol. And this is an online humanitarian effort that we're trying to use to teach anyone that knows how to put in a needle to take care of other caregivers. Now, good wellness requires diet, exercise, rest, sleep, a good attitude, and an engagement with the community. With Judaism, the diet, exercise, rest, sleep formulas are still demanded. The attitude and community are still demanded, but now we're talking about food for the soul and bagels. Now we're talking about exercise, which is right living, which is giving, caring for others, tzedakah. We're talking about rest and sleep. We're talking about the sleep of the righteous, sometimes occurring during a sermon, but not always. No disrespect intended. Attitude, teshuvah, repentance, and our response to the community, and our attitude also in tefillah through prayer. Our support and group psychology of one another, and our seeking of redemption through trying to heal the world with tikkun olam, through activism. So what can you do? Go exercise, be active, but do it safely. Don't hurt yourself. Nourish yourself, eat well, breathe deeply, think clearly and deeply. Rest, sleep enough, not too much. Maintain positivity, participate in peer groups, stay connected. More specifically, Tai Chi, yoga, exercise. If you're quadriplegic, there's still exercise you can do. What you can do is what you can do. You find your own domain of what you can do. Prayer, music, meditations, giving to others, activism. These are all things to do. Love, giving love, feeling love, being loved, and living. That's ultimately what we have to get back to. So it turns out that the interplay, the Venn diagram between freezing, fighting, and flighting is playing. And this is where we have to turn all of our emotions into positive seeking of giving, nurturing, playing, loving, and caring for one another. So thank you very much for your stress indulgence tonight, and I will welcome any questions that you may have.
Thanks, thanks so much, Mitch. That was a lot of information, and there was some really interesting concepts that you touched on, and that wanted to ask you about. One of them was, you know, in terms of how can we, are there ways that we can sort of train the body to be able to deal with stress? And you know, we talked about the benefits of stress, that there is sort of an ideal way or an ideal amount of stress that allows us to perform optimally. Is there some way that we can train the body, that we can learn sort of how to reach that sort of optimal level of stress so that we can perform best in life?
I mean, I think that's all of our goals as people, to how to be the best people we can be. And I think the idea is that one word to express the entire approach is balance, because you need to have the balance of the sympathetic and the parasympathetic. It's all, if all you do is lay around and digest and eat and digest and eat and digest and ruminate, that's not a whole life. And if all you do is run and fight and run and fight and run and fight and run and fight, that's not. You have to have a balance. So that's what I would say is what you have to seek in your daily life. So it's like I would talk to a patient about how to deal with migraine. I'd say, you know, when you have the onset of migraine, I want you to do this meditation. I want you to imagine warming the back of your hand right over that point where you do acupuncture, because that's a way of calming the sympathetic nervous system. But I don't want you to learn that while you're having a migraine, because in the middle of a migraine, you're not going to be able to learn that. You have to practice these skills on a daily basis. So you have to have good daily life habits, nutritional, physical, resting, mental, psychological habits that you practice on a daily basis, so that when you're called upon in extraordinary circumstances, you have a reserve, a reservoir, and a repertoire upon which you can call upon.
Excellent. And you know, I think you touched on the importance of the musculoskeletal system as sort of for proper regulatory function, right? And
Yeah.
so in my mind, you know, that immediately brings to my thought, you know, exercise, you know, the importance of exercise, and you know, how, you know, why we always get such a beneficial feeling, a good feeling, the release of cortisol, you know, and when we're exercising, that runner's high maybe that you're getting, you know, as well, you know, and how that can help to reduce stress, you know, and improve the immune system, and you know, improve, you know, your neurological, you just think better, and everything.
I mean, everything that you're saying is true. Exercise helps all of those things. But I will say also, just as a counterpoint, that in my clinical practice, I saw a lot of people that were injured in their exercising. So that when I talk about exercising, it has to do with recognizing who you are and what you can do. In other words, what I used to do when I was 18 is not what I do today. And even if I say to myself, I'm going to do what I did when I was 18, my body won't do that. I don't have that body anymore. So that you have to, if you're a paraplegic, you're not going to go running, but there are things you can do. If you're a quadriplegic, there are things, even more things you can't do, but there are things you can do. So if you've got severe osteoarthritis, you're not going to go on marathon walks. You have to work within the domain of where you find your existence. So I find that people tend to hurt themselves when they lose awareness of what they're capable of doing and try and do too much.
We have a wonderful question from our viewers that thank you. Could you please address the digital influences and the unconscious brain? I think it would be helpful to highlight these vulnerabilities again, and its connection to division in today's society.
Well, the problem is that the higher functioning brain is not where we make our emotional decisions with. We make our emotional decisions with our Paleolithic Stone Age brain. And while that is where we get our gut feeling like, that's right, that's wrong, he's wrong, he's right. No, I agree with this one. No, I agree with that one. It's prone to being hacked. It's prone to being misrepresented, to being propagandized, so that you can, you know, watch just a left-wing station or just a right-wing station and think that that is the universe, so that you then start to react with just a skewed sort of response, so that the brain has to reside in its celestial position of saying, one second now. The world that I'm seeing out there, the real world that I'm seeing out there, has these factual elements to it. And I see them with my eyes and my ears, and I smell them, and I taste them, and I know them with my hands, and I feel them with my bodily senses, and I'm aware of them. And this is how I know about the world. This is how I can sense, and this is what I know is real.
That's right.
And so at some level, the digital is more highly susceptible to manipulation, because, for example, our brains work at how many clicks per second? 40 clicks per second. If you make a movie film more faster than that, or slower than that, or faster than that, your brain won't be able to interpret that. Or maybe it's slower than that. Slower than that, your brain won't be able to blend them together. But the technology is making decisions much faster than that, much faster than that, much faster than that, much faster than that. So that you've got to be able to recognize that there can be subliminal things happening that you don't consciously recognize. Flashing Coca-Cola signs were the old joke in the old days. That would make you want to go drink a bottle of Coca-Cola. But it turns out that such things do occur and do exist. And that manipulable world, I just actually heard a really interesting talk with Shoshana Zuboff, who wrote the book Surveillance Capitalism. She was in town last week, and she talked about how, you know, they use the capitalism's surveils us through all of our interactions on the computer. Every keystroke, every pause over a keystroke, it knows what we're doing and what we're intending, and it makes predictive assessments of us far faster than we can predict our own assessments, because it's supercomputing and we just have brains. So yeah, I would say that the less digital, the better, the more real, the more interpersonal. Keeping it real is really important. That's why those qualities are very necessary to maintain reality.
One other question as well, Mitch. You mentioned sort of very briefly the sort of the incredible number of neurons that are involved in the sort of enteric system and gut, the importance of the gut and perhaps the microbiome. And I know that there's some emerging science now on the importance of the microbiome, the bacteria that we have in our gut, and neurology, the function of the brain, the immune system. Is that and maybe diet and how it plays a role in there. And do you feel that sort of our diet and stress that can play a role in terms of how we deal with stress as well?
Yes, yes, and yes. So, I mean, I remember being taught you are what you eat, but I don't remember being taught all this stuff about the biome. And the biome is incredible. Turns out that people now think that Parkinson's disease originates in the biome, that a lot of neurologic disorders originate in the biome, imbalances in the gut bacteria that allow for imbalances to occur in the brain, neuropeptide levels that allow for imbalances and inflammation in the brain to occur. And that inflammation in the brain to occur causes irritation and inflammation of the glial cells, and they become toxic to the neurons. So a lot of neurodegenerative diseases are now being blamed on gut health. One of the primary interventions now for MS, we talk about all these high-end monoclonal antibodies. I prescribe plenty of them, but now we're talking about how about subtyping your microbiome and optimizing your nutritional ingestion to optimize your microbiome for immune regulatory optimization. We're just on the cutting edge of some of that stuff now. But the biome is going to be a big player in all that is coming forward because it's our internal, external world. I mean, there's a whole world on our insides, and there's a whole world on our outsides, and we're in between. That's us.
Yes, exactly.
Hey, Dr. Elkiss, there's one more question from the gang, but I wanted to ask a question that I've had. One of the things that hit home that you mentioned at the beginning was there's an optimal part of stress where you function the best, where if you're too relaxed, you don't optimize, actions of what you get to do. And obviously, if you're overstressed, you don't as well. So from a tactical standpoint, if I wanted to get up in whatever I'm doing that day, whether I'm doing sports or whether I'm at my job or just doing things around the house, what are the healthy ways that I can get my stress level up to kind of a place where I'm going to perform well, as opposed to an unhealthy way to get stressed? Because
okay, I'll tell you what to do. Take a break. Get out of your chair or off your couch or out of the room you're in. Change your environment. Go outside. Get outside. Take a breath of fresh air. If it's raining, take an umbrella. Engage with nature. Nature is powerfully healing. If you're prayerful, go to prayer. If you're meditative, spend some time in meditation. That doesn't have to be religious meditation. It can be body scanning, progressive relaxation, or it can be religious scanning.
Doesn't that all tend to lower my stress?
Well, it sounds like you're talking about you have plenty of stress when you're at work and you're wanting to know how to mitigate your extra stressors so that you're always at peak level of stress performance. So that means you need to have stress time and non-stress time, stress time and non-stress time. And I would actually program your day that way so that you have periods during your day where you can go play racquetball or squash, and then go have a business meeting, and then have a dinner with your family. So you have programmed opportunities to do both vegetative, parasympathetic activities and sympathetic, creative, get out there and do it stuff.
Got it. So it seems like exercise or getting out in an environment does both. If you're overstressed, it helps you downgrade your stress. But if you're too relaxed, it also helps you get it does both things, if you will. If you're lazy,
well, here's the thing is that somebody once said that doctors know things. Well, that's doctors are trained in a lot of stuff, but when it comes to really knowing things, nature knows things. Nature knows what you need. Doctors may think they know what you need, and sometimes they're right, and sometimes they're not. They're good, educated guessers. We tell good stories, but nature really knows, really knows. So
Got
when
it.
you go outside, as a matter of fact, that's one of the tests we use for certain kind of treatment, is that if you go outside on a nice day, on a sunny day, and you don't feel inspired, something's wrong. If you
Right.
don't feel your heavenly purpose, something's wrong. And those are all signs that something's wrong.
Got it. Makes sense.
And we have one final question, Mitch, which was what the connections between the brain and cancer.
Well, the brain is the ultimate tool of the system, but it is just a tool of the system. Cancer is a disorder of cells gone wild. What causes cancer? Not known by me. I mean, there's a variety of things that are known to cause cancer, from environmental things to genetic things to behavioral things to traumatic things. And that I know that the brain plays a major role in the mitigation of stressors, all the stressors I've mentioned. And I don't doubt that the brain plays a significant role in the immune competency of the organism, which helps determine whether a cancer can grow or not. I don't question whether the brain plays a role in the connectivity with the endocrine system to determine whether the circumstances are friendly for a cancer to grow. And don't hear this clearly, I'm a fasciaist. I'm a member of the International Fascia Congress, and it's held in concert with other organizations. And a few years ago, it was held in concert with the oncology group. And last year it was with Memorial Sloan Kettering. And they talk about how the nervous system, the way the nerves know how to regrow and get to their termination is they follow the connective tissue pathways, just like the arteries and veins. And also that's how the cancer cells travel. They travel along those planes. So understanding those connective tissue planes and how they all interact with one another, intersect with one another, because we are the complex beings we are, but our brains are undoubtedly part of the best of who we are when it's a good day, the worst of who we are when it's a bad day, and a part of who we are every day. So it's it's good to learn how to use your brain optimally. And that requires regular use, regular training, and it's not something that you can take for granted.
Excellent. Well, Dr. Elkiss, thanks for an amazing seminar tonight, and we learned a lot. I'm sure that during these stressful times, hopefully we can take a few of these tools and go out there and help to sort of mitigate our stress a little bit.
You could just walk outside of Shir Shalom and take a look at the stained glass of the windows, stand in the lobby, look at the balancing stones on the lawn. These are all things that you can do to embrace the balance around you and help find it in yourself. Thanks so much for the offer and the opportunity to speak tonight. It has been my pleasure. Thank you so much.
Thank you very much.